Hi folks, thank you for listening. I'm Jonathan Schinkel here with the Health Horizons Medicare Solutions and the Wealth Training Academy Insurance Division, here giving this presentation on open enrollment for Medicare 2026. What do you need to know and what changes are going on as we speak in the Medicare world? As you know, I'm Jonathan Schinkel, local agent and advisor here with Health Horizons Medicare Solutions. I specialize in Medicare health insurance, Medicare supplements, Medicare Advantage, Part D drug plans, as well as regular individual health and life insurance. And now we offer a full service retirement planning suite with our team here at the Wealth Training Academy. So you're welcome to reach out, set up an appointment. We offer full service tax strategy and tax planning, CPAs on staff, estate planning with estate planning attorneys, and investment management, and of course the insurance division, which I'm the leader of here. You're going to be hearing from our team. We have a new agent named Crystal who's working with us, as well as Miriam and some other insurance staff here at our office. So let's get right into it. Again, if you're new to Medicare or relatively new, you're going to want to listen to this entire presentation. If you're familiar with all the parts of Medicare and you just want to hear about what's going on with changes for 2026, feel free to skip ahead in this video and we'll cover that portion. Now, we want you to understand your options and what's going on with Medicare. We want to give you the best advice possible. We know, of course, you are bombarded by advertising with telemarketers calling you, of course, knocking your door down with mail, different advertisements and things like that. And there's a lot of misleading information or just flat out false advertising that takes place. And so our promise to you is to offer unbiased advice to try to make this simple, easy to understand, give you the very best advice possible. There's a lot of value to working with a local agent who understands your area, your hospital and doctor network in that area, what plans are available in the market. So please, at any time, feel free to set up an appointment or a phone call with us here. Today we're going to do a quick review on what are the parts of Medicare, difference between Medicare Supplement, Medicare Advantage, how to evaluate the plan choices here during open enrollment, as well as some important dates that you need to know. So of course, what is Medicare? Medicare is our country's health insurance program for those 65 or older or under 65 and on disability, administered by CMS, the Center for Medicare Medicaid Services. They make the rules, and that's why this is complex and changes year to year, is because it's run by our government. Parts of Medicare, Part A and B are known as traditional Medicare. Part A covers your hospitalization, hospice, things like that. Part B is anything outpatient, that is doctor's testing, procedures, surgery, diagnostics, things like that. Part C is your Medicare Advantage. This is an all-in-one comprehensive health program that covers your Medicare A, B, and D all together in one plan. It's offered by a private company that's approved by Medicare, and it's going to be an HMO or PPO plan. That means it has a network of doctors. Now, you have to stay within that network to get coverage, but you get all your services through that plan, and it often includes extra benefits like dental, vision, hearing insurance, as well as maybe some other benefits. Part D Medicare is prescription drug coverage. You either get this through your Medicare Advantage plan or by selecting a Part D plan from a private company approved by Medicare. Lots of options available in your area. We can help you shop for those as well. And lastly, we have Medicare Supplements, or Medigap as it's known. Now, what is Medigap? Medicare Supplement insurance is something that you purchase in addition to your Medicare. As you may know, Medicare only covers about 80% of your care. Part A hospitalization, they charge you a deductible of $1,600. However, under Part B, you pay a 20% co-share. They pay 80, you pay 20. No limit on what that cost can add up to be. Therefore, the need for a Medigap policy. Now, a Medigap policy is going to cover most of those out-of-pocket costs related to Medicare A and B. It works like a buffet. You pay a single monthly amount, and then whether you use it or not, as much as you want to use it, you have all of your costs covered. You're not going to get any surprises, any bills in the mail, that sort of thing. It's expensive, but robust coverage. Now, why wouldn't everybody pick a Medigap policy? Well, the question is price. That's the answer. The price, like I said, is based on your age, and it does go up every single year as you get older. Can be quite expensive, especially if you're relatively healthy and are not going to use it very often. Now, Medicare Advantage Part C, what does this mean? Medicare Advantage, like I said, is an all-in-one solution for your Medicare. It's going to be through a private company. It's going to be an HMO or a PPO plan, which means it does have a network. And typically it's going to be a very low price point, often $0, and then you pay a copay for each service that you get done. So use it a little bit, you're going to only pay a tiny bit that year for your medical costs. Use it a lot, getting hospital stays, surgery, diagnostic testing, your costs are going to be higher and higher, potentially up toward that maximum limit. All plans have an out-of-pocket limit, which is something that is important to pay attention to. What is the out-of-pocket for your plan? Is that changing next year? That's going to be in your annual notice of changes. All right, so what's going on here in 2026? Why are so much changing? Well, we've been in a big restructuring within health insurance across the industry, not just for Medicare, also for Obamacare, it's known as ACA, and these regulatory changes and the downstream effects of the companies having to adapt to those changes is going to impact your employer group health insurance plans as well. So we have a lot of industry headwinds and cost pressures that are making it difficult for these companies to do business. Number one that's causing this, of course, the Inflation Reduction Act came out a few years ago. We are still dealing with the implementation of that. The shift of drug costs away from Medicare and away from the consumer onto the insurance company results in the insurance companies being squeezed and needing to increase costs onto you, the consumer. Additionally, we of course have the COVID catch-up. People during the pandemic did not go out and get cancer screenings, regular tests, things like that. Everybody was kind of hunkered down at home for that season. We are still in a place where those claims of post-COVID people going out getting these things done, the insurance companies paying those claims and thus needed to raise their cost. Lastly, a big thing I'd like to mention is CMS reimbursements. They were reduced 2 years in a row at the same time that this COVID catch-up was causing a lot of cost pressure for these companies. And then lastly, CMS actually reduced the star rating for several Medicare Advantage companies. You may have seen in the news lawsuits, United Healthcare and Humana actually suing the government over their star rating. Now, all Medicare plans are rated by the government 1 to 5 stars. That tells you a lot about how good the customer service is, how good the plan's network is, how good its drug coverage is. And if those companies lose a star in certain plans, it greatly affects the money that they get back from the government to provide coverage in those plans. And thus, they need to reduce benefits and raise costs for you, the consumer. So that's a bit of the landscape that we are finding ourselves in currently here in 2025, heading into 2026. So what do we see happen as a result of that? Well, we saw costs go up quite a bit. Medigap rates went up in double-digit levels 2024 and 2025 to accumulate for these losses that the insurance companies were needing to take on the amount of claims they were paying. Additionally, we saw about 10% of people on Medicare Advantage lose their plan last year and have to choose a new plan. That is called a reduced plan choice, plan exits that took place. We expect to continue to see that this year. Additionally, higher out-of-pocket costs and copays on many Medicare plans, and then a reduction of those extra benefits, think grocery cards, transportation, gym memberships, things like that, beginning to be pulled back on various Medicare Advantage plans, again, as a cost saver for the insurance companies. So what do we expect this year, 2026? Well, we expect the same thing essentially to continue. According to the Medicare Trustees Report, they estimate what the Medicare program needs to charge everyone enrolled in Medicare for that monthly amount for Part B in order for Medicare to frankly stay liquid and continue as a government program. In their report, they said that $206 a month ought to be around the area that the Medicare Part B price goes to for 2026 in order to make the program sustainable. So we expect for the Medicare Part B premium to go up from $185 to around $206 a month for next year It's about an 11% price jump, which is significant. Again, we expect Medicare supplement rates to continue to rise. If you have a Medigap, Plan F or Plan G now, you probably noticed this year that those rate increases continued to go up, some at double-digit price increases. Additionally, we expect this Medicare Advantage disruption that we're in right now within that market to continue. We expect that to heavily affect PPOs, continued plan exits from those PPO plans, reduction of extra benefits, provider networks being reduced, things of that nature. We expect that to continue. So how should you evaluate your choices heading into open enrollment? Well, number one, we need to make sure that you are paying attention to the doctors that you see and the prescriptions you take, as the coverage changes year to year, and it can affect your ability to access doctors and can affect the price that you pay in co-payments and co-insurance on your medications. Additionally, do you have a traditional supplement policy? Where is that rate today? And should you look at potentially, if you're healthy enough to pass underwriting, work with an agent like myself and look at other options, either from a different insurance company, if you're on a Plan F with a different company, or potentially go down to a Plan G or Plan N. Slight reduction in your benefits, but a big cost savings in the monthly premiums within the Medicare supplement space. If you're on Medicare Advantage, your plan will send you a notice of changes by the end of September that details 2025, 2026 side by side. You'll be able to see what the changes are. Of course, if your plan is no longer available, you'll get a letter that your plan is not renewing, and you will need to select new coverage for 2026. All right, I always like to say, please avoid talking to telemarketers, 800 numbers, anybody who contacts you like that, the Joe Namath on TV, that they offer to give you the world, come bring your newspaper in, walk your dog for you. There is lots of deception and bad advice that is out there. Even well-meaning friends can have wrong information and share that wrong information with you. And so it is no cost to you to work with a local agent like myself. Highly recommend you set an appointment with us. Myself, Crystal, someone on our team would be happy to review your plan, what's changing, and help make sure that you're set up for next year. All right, important dates. Starting October 1st, you can view the plans changes for next year, what other plans are available. In addition to that, talk with an agent like ourselves to review your options and potentially make a choice for 2026, what's going to be most appropriate. Starting on the 15th of October, going all the way through to December 7th, that is the open enrollment period where you can actively make a plan change. Now, many people don't realize January 1 to March 31 every single year is another open enrollment period, and that is for Medicare Advantage. So if you have a Medicare Advantage plan, you get a second chance, 2 chances to make a change. During AEP each year, October 15th through December 7th, and then the first quarter of the next year, you can make an additional change. Lastly, if you are on a Medicare supplement policy and you want to try Medicare Advantage, you have what's called trial bite. You can try that out for up to a whole year. Anytime within that first year, if you decide you're not happy, you want to go back to a supplement policy, no matter your health situation, you are able to switch back, no questions asked. Great opportunity that the government gives you to let you try Medicare Advantage, see if it's right for you, and then switch back should you need to. So thank you so much for spending some time with us today. Hopefully this was quick, informative, gave you a good idea of what you need to do as we approach this open enrollment period for next year. Please schedule an appointment with us, schedule a phone call. We're happy to review your options and become your agent for your health and life insurance. Again, I'm Jonathan Schinkel here with Health Horizons and the Wealth Training Academy. Thank you for watching. Have a great day.